and more coronavirus deaths in New Mexico's nursing homes and senior living facilities. So how is the state handling outbreaks in these vulnerable populations? Here's News 13's Jackie Kent.
Given how contagious COVID-19 is, the elderly and people with underlying health conditions living in close proximity are especially at risk.
Our role has been to do as much outreach as possible to not only the facility staff who are there on the ground, but also to the residents.
Aging and Long-Term Services and the state's Department of Health Improvement, or DHI, say they're in constant contact with living facilities to try to keep people safe. Multiple deaths have been reported from places like the Life Care Center in Farmington and La Vida Llena in Albuquerque. The state's DHI team checks in daily with state licensed care facilities. If someone working or living in a congregate setting tests positive for COVID-19, that facility is ordered to conduct weekly mass testing of everyone living and working there. An administrator for Advanced Healthcare of Albuquerque tells us all their staff wears full PPE and their residents are isolated in private rooms. They also do regular virtual and in-person walkthroughs with state health officials, and they're not accepting any visitors or new residents. As for what the next year looks like for these long-term care facilities, the state says that's the million-dollar question.
We know there'll be an end to this. I think that probably the biggest thing is family members engaging however they can, whether it's telephonically, writing letters.
The state tells us they're really focusing testing on long-term care facilities and essential workers, especially since asymptomatic carriers can spread the virus to others and temperature checks can only catch some cases. That's why staff is taking extra precautions like wearing protective gear. Back to you.
Okay, Jackie, Advanced Healthcare of Albuquerque tells us when they do start accepting new residents down the line, every new person will have to go into a 14-day quarantine and take a test.